Have you ever wondered what it really means when someone is on a ventilator? These machines are incredible pieces of technology, quite literally a breath of life for people who can't breathe on their own. Today, we're going to pull back the curtain and see exactly how they work. So, here's our game plan. We'll start with why someone would even need a ventilator. Then we'll get into the core science of how it works, this thing called positive pressure. After that, we'll see that it's not one size fits all, look at the supercritical settings, check out the built-in safety net, and wrap up with the most important part, the human experts behind the machine. Okay, so first things first, why do we even need ventilators? Well, it all boils down to one critical problem: respiratory failure. I mean, think about it for a second. It's a terrifying thought, right? Breathing is something we do without even thinking. But when an illness or an injury takes that ability away, the body's entire system starts to shut down. And that is the exact moment when a machine needs to step in and take over. Now, here's a key thing to understand. A ventilator doesn't actually cure anything. What it does is buy time, precious, life-saving time. It does the hard work of breathing for the body, which frees up all that energy so the patient can fight off an infection, heal from a major injury, or recover from surgery. It's really a bridge to recovery. So the big question is, how on earth does a machine breathe for a person? Well, the answer lies in a really elegant and powerful concept: positive pressure. Let's break down what that actually means. You've probably seen pictures of the old iron lung, right? That was a negative pressure machine. It basically sealed a person inside a giant can, created a vacuum, and physically sucked the chest wall outwards to pull air into the lungs. Modern ventilators, they do the complete opposite. They gently push air in. Okay, so the mechanics here are pretty cool. The ventilator creates a little bit of pressure, just enough to be higher than the pressure inside the lungs, and that gentle push inflates them. Then, to exhale, the machine just stops pushing. That's it. The natural springiness of the lungs and the chest wall does the rest, pushing the air back out. So breathing in is active, but breathing out is totally passive. That's the core idea of all modern ventilators. But here's something you might not realize. Ventilation isn't just a simple on or off switch. It's this whole spectrum of support that can be perfectly customized to exactly what a patient needs at any given moment, from just a little bit of help to complete life support. So on the simplest end, you have something called CPAP. Now, this isn't really breathing for you. It's more like support. It delivers one single constant pressure that basically props your airway open, keeping it from collapsing. The analogy of a pneumatic splint is perfect. You see this a lot for things like sleep apnea at home. Now, one step up from that is BiPAP. The bi means two, so it provides two levels of pressure. You get a higher pressure when you breathe in, which helps get air into the lungs, and then a lower pressure when you breathe out, which just makes it a lot easier to exhale. It gives you a bit more of a boost than CPAP. And this right here, this brings us to a super important point, and honestly, a source of a lot of confusion. In the hospital, you'll hear doctors and nurses use the terms BiPAP and NIV, which stands for non-invasive ventilation, almost interchangeably. But the actual machines they're talking about can be worlds apart. See, on one hand, you've got a home BiPAP device. It's designed for sleep. It's simple, has very few alarms, and no backup battery. But a hospital NIV ventilator? That's a different beast entirely. It's a sophisticated medical device with a full set of alarms, tons of monitoring, a battery so you can move the patient, and way more advanced modes. And it's not just a small difference. It's critical for safety. As Dr. Broughton points out here, when a patient is really sick and you need precise delivery and a safety net of alarms, you need one of these more complex machines. Just saying put them on BiPAP could mean two very different things, and getting it wrong is dangerous. Terminology really, really matters. All right, so once the team picks the right machine, they don't just plug it in and walk away. It has to be programmed, almost like a flight computer. Clinicians have to dial in a whole set of very specific parameters to create the perfect breath for that one patient in that one moment. Because here's the risk, and it's a big one. Lungs are incredibly delicate. I mean, think of them like super fragile balloons. If you push in too much air, that's volume, or use too much force, that's pressure, you can actually damage them. It's a serious complication called barotrauma. So how do you prevent that? Well, clinicians have very direct controls. First, they set something called the tidal volume, which is just the amount of air in each breath. Then they set a maximum pressure limit. It's like a ceiling. If the ventilator ever hits that pressure, it immediately stops the breath to protect the lungs. But it's not just about the force of the air. there's another hidden danger, and this one might surprise you. Oxygen itself. Yeah, the stuff we need to live. In very high concentrations over a long time, it can actually become toxic and create these harmful molecules that damage the lungs. And this is a perfect example of the delicate balancing act they're constantly managing. The control for this is called the FiO2. Now, the air you and I are breathing right now is about 21% oxygen. A ventilator can deliver anything from that all the way up to 100% pure oxygen. The goal is always to use the absolute lowest amount they can get away with to keep the patient safe, but no more. Okay, so with all these critical settings and potential risks, you can imagine things can sometimes go wrong. That's where the ventilator's safety net comes in. The alarms on these machines aren't just annoying beeps, they are a patient's lifeline. Check this out. Each alarm is tied to a specific danger. If the pressure in the system suddenly spikes, which could be a sign of lung damage, bam, the high-pressure alarm goes off. If the patient themselves stops breathing, an apnea alarm sounds. If the tubing somehow gets disconnected, a low-pressure alarm tells the team immediately. It's a vigilant 24/7 guardian. We've talked a lot about the technology, right? The pressures, the settings, the alarms. But you have to remember, a ventilator is an incredibly powerful and complex tool. And any tool is only as good as the expert who's using it. You see, successful ventilation is never a one-person job. It is this amazing collaborative team effort. You've got physicians who set the overall strategy, critical care nurses who are at the bedside monitoring the patient's every response, and respiratory therapists, they are the true masters of the machine, managing that delicate connection between the patient and the technology. And that really brings us to our final and maybe most important thought. This technology has the power to save a life, absolutely. But without constant vigilance, it also has the power to do harm. So while the machine provides the breath, it's the expertise, the judgment, and the tireless dedication of the healthcare team that truly breathes life back into the patient.